Welcome to The Explainer. Today, we're undertaking a deeply important and, frankly, a very empathetic educational journey. We're going to look closely at a condition that profoundly affects how individuals connect with the world around them, often trapping them in a quiet, invisible struggle. We're exploring Avoidant Personality Disorder. By really grounding ourselves in the clinical realities and the profound emotional truths of this condition, we can foster a much safer, far more compassionate environment for those who live with it. So, take a deep breath, settle in, and let us begin this process of understanding together.
Okay, let's dive into the syllabus. First, what is avoidant personality? Second, identifying the core symptoms. Third, navigating general medical care. Fourth, approaches to psychological treatment. And finally, breaking the ignorance barrier.
Section 1. What is avoidant personality? Laying a foundation of profound empathy.
Consider the crocus flower. It is incredibly beautiful, yet so delicate, opening up only under the absolute right conditions. This serves as a powerful metaphor for the core emotional reality of avoidant personality disorder. At a foundational level, you see, individuals living with this disorder are deeply, fundamentally socially inhibited. They walk through life burdened by an intense, persistent feeling of inadequacy. Every single interaction is weighed down by the fear that they are simply not enough. Furthermore, they're overly exquisitely sensitive to criticism. A passing comment that you or I might just brush off, well, it can feel absolutely devastating to them. They're guarding a very, very fragile sense of self.
Section 2. Identifying the core symptoms. Diagnostic criteria. Let us look at how this internal fragility manifests in measurable ways.
According to the diagnostic guidelines, a person must exhibit a pervasive pattern of this behavior by early adulthood, presenting 4 or more specific symptoms. This includes avoiding occupational activities that require significant interpersonal contact, specifically because of a fear of disapproval or rejection. It includes being unwilling to get involved with people unless they are absolutely certain they're already liked. They show heavy restraint even in intimate relationships because they're terrified of being shamed or ridiculed. They are preoccupied with being criticized in social settings, inhibited in new situations, and they fundamentally view themselves as socially inept, personally unappealing, or just entirely inferior to others. Furthermore, they are unusually reluctant to take personal risks or engage in new activities because it might prove embarrassing. Now, what's really interesting about this slide is that these behaviors are not merely shyness, not at all. They are a highly structured defense mechanism. Every single action or inaction stems directly from an intense, overarching fear of rejection.
Section 3. Navigating general medical care. Physical health challenges. Because this fear of rejection doesn't just impact friendships, it deeply affects physical health.
When a person with avoidant personality disorder falls physically ill, a very challenging dynamic occurs. Their pre-existing shyness and insecurity can profoundly intensify. The very thought of being scrutinized during a physical examination brings immense, almost unbearable embarrassment. Because of this extreme vulnerability, they will often downplay their physical symptoms to the doctor, or worse, delay seeking necessary medical help altogether. This extreme embarrassment is a critical hurdle that all medical professionals must thoroughly understand if they are ever going to provide effective care.
To navigate this, the physician must carefully steer what the literature calls a middle course. It's a delicate balance. Step 1. The doctor must avoid inadvertently cooperating with the patient in minimizing their complaints. Otherwise, they risk completely missing the diagnosis. But Step 2. They must also avoid being overly intrusive, because that threatens the patient's profound sense of privacy and modesty, which can quickly lead to the patient abandoning treatment altogether. So, the crucial point is Step 3. Utilizing a low-key, structured approach. This means the doctor emphasizes friendliness and availability. They must return phone calls promptly, strictly respect punctuality at appointments, and offer periodic reassurance of their commitment. By doing this, the doctor actively counters the patient's normal, deeply held inclination to see themselves as unimportant or undeserving of the physician's time and attention.
Section 4. Approaches to psychological treatment. Targeted care. When we transition from general physical care to targeted psychosocial care, the nuances become even more pronounced.
Before treating the disorder, therapists must understand how it differs from other conditions. Consider this vital distinction. An avoidant patient possesses a defense against relating. Conversely, a schizoid patient possesses a deficit in relating ability. And this brilliantly illustrates a crucial point. The person with avoidant personality disorder desperately wants to connect, but they are terrified of the rejection that might come with it. They are defending themselves. The schizoid personality, on the other hand, lacks the fundamental drive or ability to relate. Understanding this difference is absolutely paramount to treating the avoidant patient with the dignity and targeted care they truly require.
For those patients brave enough to come to therapy, the clinician must first address the patient's neurotic equilibrium. Now, what does that actually mean? It means the patient's symptoms, their avoidance, their isolation, have actually created a balanced, albeit painful, coping mechanism for them. Any rapid change to these symptoms would violently upset this equilibrium. Therefore, initial treatment must be incredibly supportive. The therapist must provide a safe, calm space to gently enhance the patient's self-image before any real exploration of changing behaviors can even begin.
Because of this immense fragility, long-term psychotherapy requires extraordinary effort from the therapist. The absolute primary principle is to solidly establish an effective therapeutic alliance first. Because of their exquisite sensitivity to rejection, avoidant patients will often abruptly abandon treatment if they feel even slightly judged. Once trust is established, unlike with schizoid patients, assertiveness training can be very useful. However, therapists must exercise extreme caution when giving outside social assignments or homework. If a patient is sent out to practice a new social skill and they fail, that failure will disastrously reinforce their already poor self-esteem. The environment must be heavily controlled and supportive.
Eventually, as treatment progresses, group therapy can be introduced. This serves a very specific, powerful purpose. It helps to gently desensitize the patient to the exaggerated threat of rejection. By interacting in a controlled, therapeutic group setting, they can slowly, safely learn that not every single social interaction ends in shame or ridicule. Section 5. Breaking the Ignorance Barrier. Community Empathy. We have explored the clinical criteria and the therapeutic approaches, but the true healing, that begins with us, the wider community.
Just as a delicate flower needs the right environment to bloom, the ultimate goal for someone with avoidant personality disorder is to eventually feel safe enough to open up to the world. Let's move to and see how this builds our understanding of our own role in mental health.
The single largest barrier is ignorance. The lack of understanding from society is exactly what makes the world feel so hostile and terrifying to someone struggling with this disorder. Ignorance breeds the very rejection they fear most.
So I leave you with this final thought. How can you apply this new understanding to foster a safer, more empathetic environment in your own daily interactions? When you encounter someone who seems intensely withdrawn, unusually sensitive, or hesitant to engage, will you judge them? Or will you offer them the patience, the punctuality, and the gentle reassurance they might desperately need? By combating our own ignorance, we make the world a little less frightening for those who are struggling. Thank you for joining me on The Explainer today. Keep learning and always keep leading with empathy.